Today's episode is brought to you by Microsoft Dragon Copilot, your AI assistant for clinical workflow, which helps to ease administrative burdens, automatically document care, streamline workflow, and focus more on the patient-clinician experience. To learn about how Dragon Copilot can transform the way you work, visit aka.ms/knockknockhi. That's aka.ms/knockknockhi.
Hey, Will.
Hey, what's up?
I've been thinking, the U.S. healthcare system, it needs some improvement.
Yeah, there's room for improvement. For
sure.
It's
a confusing, scary place for everybody involved.
Absolutely.
Physicians, families, patients, everybody.
Everybody. And I've experienced it from both sides, right? I'm a physician. I've also been a patient. So I wanted to use my platform to give people practical education, really the only way that I know how, by making jokes. So Dr. Glaucomflecken's really fun and super uplifting guide to American healthcare is out. And it's a free resource that includes all my videos from the 30 Days of Healthcare series, alongside deeper explanations, also reliable facts, emphasis on reliable.
Yes.
All right. Figures, numbers, insights into how each of us can fight for a more humane, better healthcare system. Also, it has jokes.
Did you mention the jokes?
I did. Jokes. Okay. Yes, definitely jokes.
Well, this guide is great for anyone looking to learn more about U.S. healthcare, but especially if you are experiencing it from the clinician side for the first time.
That's right.
We really hope you'll check it out.
Get the free guide sent straight to your inbox by signing up for our mailing list, glaucomflecken.com/healthcare. Enjoy. Hi. Hi, everybody. Welcome to Knock Knock Hi with the Glaucomfleckens. I'm Dr. Glaucomflecken, also known as Will Flannery.
I am Lady Glaucomflecken, also known as Kristin Flannery.
I don't know why I'm trying to say it as fast as possible. But anyway, welcome to Glauc Talk, where the Glaucs talk. And so I'm excited for you guys to join us today. And we got some fun stuff to talk about. Are you enjoying learning medicine with me?
Would
I be a good professor? Because we've been choosing these. We've done a couple episodes now where I've selected random medical topics and we've talked about it on the podcast. Mm-hmm. Do you think I should maybe think about a career in academics?
No, definitely not.
No?
Nope. That is not your jam. But that said, you are a good educator. But you are an unconventional educator. Like all your videos educate, basically.
Well, so why couldn't I teach med students?
You asked if you would be a good academic.
Well, I mean,
I know all the things that go along with an academic career, and no, you would hate it.
What are the parts of being an academician that I would hate?
Academician.
Is that not a real word?
I don't know. It just sounds funny.
It's a real word.
You would not. Usually people just say an academic.
Pediatrician, academician.
Academic. You would not like having to do research, and most academics, you get into it because you like the learning and the teaching, and then it turns out you have to do mostly research.
I think maybe that's not quite true in the medical world.
Maybe not.
I do know people that don't do really. It's like you're on a clinical track.
Yeah, so you're only
in
teaching.
An academic setting, so you're doing more teaching.
Yeah,
but that's mostly on a residency level. I think on a med student level,
mm-hmm.
Med school, maybe it's probably.
But there's no full-time med school professors, are there? They're all.
I think so, but they're
not practicing.
Well, they are. I mean, yeah, probably doing maybe a little clinical. I think there are some, but they probably also do research.
Yeah.
Yeah. So I think you're right.
Yeah.
Yeah. Well,
you do a good job of educating. It's just you do it in unconventional ways.
Well, when I open up Glaucomflecken School of Medicine, research won't be allowed. Outlawed.
That's an interesting take.
We will disband the IRB. And
I don't like where this is heading.
You won't be allowed to calculate a p-value. Mm-hmm. You will not talk about your materials nor your methods. Just
what will you talk about?
U.S. Simile first aid.
Okay.
Pass your tests. Content creation.
Yeah.
Maybe we'll have a little unit on that.
Yeah, we're working on putting together some curriculum on that front, so it may not be as ridiculous as it sounds.
But if we're being honest, no one's going to hire me. The LCME is not going to allow me to start my own med school.
No, you won't be accredited.
At this point. Yes.
Right.
It won't be. You can come to my med school, but you will not be an accredited med school. Mm-mm. So, I'll write you a letter of recommendation, but good luck getting into a residency program. All right. So let's start with a little thing on Instagram.
Yes.
So we talked on the podcast about the fact that I'm kind of like at times like David Putty from Seinfeld.
Yes.
I am able to just turn it off. Turn my brain off. Like I don't have thoughts.
Right.
And surprisingly, but
I said I can't even comprehend that. Like I don't get it because I cannot ever turn my brain off. It is always thinking.
And so this is like I was kind of surprised by that. Like I can't imagine
Yeah, you can't comprehend what that would be like.
Not being able to just like stop. Like stop your action potentials. Like
I don't think that's how it works.
Like turn down, don't release as many neurotransmitters into your synaptic cleft. All right? Just like cool it. Just put it on ice.
I don't know.
And so a lot of people, it's funny. So we cut a clip of that.
Yeah.
From the podcast and we put it on socials and people were, it was interesting because lots of different opinions.
Yeah. This is a thing apparently because a lot of people chimed in.
So our friend over at Med Crisis said, meditation, not a new concept. I thought I had invented meditation. I don't know. Like it's like, can a dumb guy just like invent meditation? Like, hey, I just realized I'm meditating.
Incidentally, I suck at meditation. I can't
have
do
you
it.
Tried?
Yeah, I've tried.
Can you guys I really think it would help Kristin to like be able to meditate. Can you give her some practical tips or resources?
I've used, the apps.
Have you really?
Yeah.
The Calm app?
Yeah. I've used several of them. Yeah. Just trying to find one that just, did it. It was, you do have to
like the
practice.
Holy Grail.
It's not just an app that can fix everything. But like, it's so hard for me to not think anything. I know they say like, you think a thought, well, then you just bring it back to nothing. And I'm like, bring it back to what? Thinking the other thought?
A successful meditation is the Holy Grail of Kristin's anxiety disorder.
Between anxiety and ADHD, like I don't know if I have any hope.
If one of you can give us the key to unlocking this for her, like you can come on the podcast. How about that?
Yeah.
Please help.
I don't know if I appreciate the tone here.
All right, here's some comments. Here are some comments over on at Spoo Spa said neurotypical versus neurodivergent.
See?
So is that us? Like I'm the neurotypical one, you're the neurodivergent.
Yeah.
Even though I'm the one that dresses up in the costumes?
Yeah, look, neurotypical doesn't necessarily mean
normal.
Okay.
Mm-hmm. Well, maybe we all have a little bit of divergence from each other. I don't know.
Of course, yeah. But I'm very curious whether that is a real thing. Like, is it neurotypical people can turn their brains off and neurodivergent people have a hard time with that? Is that like legit?
Some more comments. I cannot comprehend. I wish I could take a break from my inner voice sometimes, but it never ever stops.
See, that's what I'm saying.
But like, there are people that like you can like hear a voice in your head talking to you. I've heard that from people.
Yeah.
Like, it's not like a hallucination. Like, it's not. It's like your own
but
thoughts.
It's words.
It's like words.
Yeah.
That blows my mind. I have no idea what that sounds like.
You don't even think in words? How do you even have a thought?
No,
it's not a word.
I don't know. I just think. I don't know. Like, I have thoughts, but it's not like someone talking in complete sentences to me.
Well, it's not always complete sentences. It could be like fragments, but it's like chatty. It's chatty in there.
There's maybe a lot of neurodivergence over on Instagram. Just ask him if he has here it is. This is what I was talking about. Ask him if he has this is a comment. Ask him if he has a voice in his head. My husband does not, and I absolutely cannot believe how that is possible.
Yeah.
I assume it's more common for men to not have an inner voice. My inner voice is responsible for my anxiety and depression, especially during years of infertility, so I'm kind of jealous.
Yeah.
I don't know what it means to have like an inner voice.
And I don't know what it means to not
like
have one.
I have thoughts, I'm thinking things, but It's not like a voice.
How do you think then? What are your thoughts like?
I just ask my neurons. They just.
I am.
The thought, and I'm thinking it.
What form does a thought take?
I think
a picture. Do you envision a picture? Do you what is the?
I mean, I don't know. If I will then use my own voice to explain my thoughts
out loud.
Yeah,
if you have to.
Right.
But what are they in your head?
A series of interconnected electrical impulses.
But what is the experience of them in your head?
All right, here's somebody else. Another comment in support of me. I do not have a voice, thoughts, whatever in my mind. It's blank. I think when I need to think. Exactly. That was from First of Seven, user, Instagram. I think when I need to think.
And that's a woman that said that.
See?
I just don't. It's not that I think one is better or worse. It's that I think that these are such different experiences that you just can't fathom what it's like to have the opposite one of that you have.
You're not thinking when you are sleeping.
Yes,
you can
you are.
practice living in a space of consciousness without thinking. But then someone responded, we literally think when we sleep.
Yeah.
Our brain is highly active during sleep, processing memories and information collected while awake. You simply aren't consciously aware of it except when you dream. But we do a big portion of our thinking while asleep. That's why I can wake up suddenly solving an issue from the day. Before that, I couldn't, because sleep thinking works in different patterns than awake thinking.
It's when our brain is like clearing out the waste, getting rid of the stuff we don't need, and it's processing the stuff that we want to keep.
Our brains are wild.
They really are.
That's crazy. I will say, like, I do think more clearly when I first wake up in the morning. Like,
that might have to do with like cortisol levels and like, you know, the wake up stuff.
Like
all the wake up hormones.
I do some of my best like script writing, content creating. I do some of my best stuff like right when soon after I wake up, like before noon.
Well, yeah, before noon. I do
and then
too.
You get tired.
I'm my sharpest probably like 9 to 1 or so.
All right. Well, shout out to all the non-thinkers out there. I'm with you. It's okay. There's nothing wrong with us. We just don't have a thought in our heads.
No, there's nothing wrong with it. It's just
our brains,
it blows my mind.
Our brains are just a bit empty, and that's you know what? I think it's a nice way to be sometimes. Like
I think that's what you're seeing in these comments is we're a little jealous. Us chatterboxes in our minds.
It does sound frankly exhausting to have a voice, someone always talking to you in your head.
But it's you.
But still, it's like you're just hearing a voice. Like, do you ever tell that thing to shut up? Like, stop it.
I said I can't do that. That's why I'm bad at meditating.
Oh, anyway, all right. So the offer still stands. Someone
teach me to meditate, please. Is there an opposite of meditating? Because maybe you need that and I need to learn to meditate.
I can't imagine it would be productive to have you meditate on the podcast.
No, that's not good audio.
Anyway, all right. Well, that's it.
Well, what about you? Are you good at meditating?
I've meditated. Yeah. I'm ambivalent about it.
Yeah.
I think I just fall asleep.
Yeah.
How do you meditate without falling asleep?
It is.
That's hard. Because it's like, because we did some mindfulness stuff. I remember as a med student, I did like a little mindfulness like elective thing. And I would fall asleep almost every single time. Because it's like you're laying down and there's like calming words.
Right.
And
sometimes
music,
it's dark.
And it's a little bit dark. And it's like, wow, this is entrapment.
Yeah.
It's like putting dilating drops in someone's eyes and then having them laying them back in the chair, turning the lights off, and then it's like, how do you not expect them to fall asleep right there in the chair? So anyway,
question. Speaking of falling asleep, when you fall asleep, like as you are actively falling asleep, are you thinking about things then?
No.
No?
I just go to sleep.
See, I don't know if you've noticed, because you're usually asleep by the time I'm able to fall asleep, but I go to sleep. I mean, not go to sleep. I like lay down.
Yeah.
Lights off, every intention to fall asleep. And then it's at least 2 or 3, sometimes more, little interruptions where I have to sit up and like grab my phone to do something or make a note to myself or set a reminder, because like as I'm falling asleep, I'm thinking of all the things that need to happen. And
the only time I have trouble falling asleep is if I've had caffeine too late, or if I get paged in the middle of the night.
Yeah.
And then sometimes I'm like, it's interesting. I'll wake up enough to like talk on the phone with somebody.
Yeah.
But then occasionally I have to call them back and be like, wait a second, I just realized what you said to me.
Oh boy.
I thought something a little bit different. It's like, hey, maybe you should consider ordering this thing. So it's like it takes a bit for my brain to like wake up.
Yeah. I'm surprised that doesn't happen more often, to be honest.
And then it's hard to like turn it off after that. It's hard to go back to sleep once you get woken up.
Once you're fully woken up. Like, remember when we had newborns, I really tried, after a few weeks of not sleeping at all at night, I was like, okay, I have to get up. Can't do anything about that. But I'm going to do everything I can to stay as asleep as possible while I am up. Like, I kept all the lights off. I got the baby. I sat down. I closed my eyes, Because, once you are like awake enough to really be processing and thinking, it's going to be a whole thing to get back to sleep.
Keeping the lights off is good because then your brain doesn't like start making cortisol.
Right.
Or actually, sorry.
Oh dear.
Guys, your brain does not make cortisol. I know that. All right. ACTH from the pituitary going to the adrenal glands to make the cortisol. All right. Gotta be anatomically correct here. All right. Let's take a break. Hey, Kristin.
Yeah.
I know that you love when I talk about the cute little mites.
Mm-hmm.
Yeah, but I thought we could take a break from that. Is that okay with you?
That's fine.
Yeah, because I'd like to focus on the eyelid symptoms and disease that an overgrowth of Demodex causes.
Okay, I like that idea. No mite talk.
So Demodex blepharitis, it often gets misdiagnosed or just missed entirely because a lot of symptoms overlap with other eye conditions.
Okay, so what are the top symptoms that people should look out for?
Usually itching along the eyelid margins, swelling, irritation, redness.
That sounds like it could be allergies or lots of other things, too.
It could be a lot of things, but exactly. And the key is if your doctor spots crusties on the margin of the eyelid.
Technical term.
Well, we call them collarettes, but crusties is a good term. That tells you it's Demodex blepharitis right there.
Well, I really like that there's a clear sign to know for sure.
And once you're diagnosed, there's a prescription eye drop treatment available for this disease.
Ooh, that is good to know.
To learn about the common symptoms of Demodex blepharitis and more, visit miteslovelids.com. Again, that's miteslovelids.com to learn more. This ad is brought to you by Tarsus Pharmaceuticals. So you went on a podcast.
I did.
You went on How to Be Patient.
I did. With Preston Roche, Margaret Duncan.
Yep.
We are executive producers on that podcast, incidentally.
Yeah, it's a great pod, if I do say so myself.
They are, well, I think Margaret has since graduated, but when it started, they were both psychiatry residents.
Yeah, Preston's still in residency. So what did you talk about? How'd it go?
It was great. We talked about, I wanted to go on to talk about dissociation after trauma because I am working on writing a book and I am writing about, my experience being a co-survivor to your cancers and cardiac arrest. And after the cardiac arrest, when I had to do CPR on you, that was obviously very traumatizing, and I was very not okay for a while. And it was a weird experience. And, in thinking about this book and researching and whatever, all the talking we do about it, I think, I wrote this piece called The Quiet Place that was trying to describe what it was like in this period that I'm talking about. And I have since learned that is probably dissociation or dissociative PTSD. And it's where you're basically faced with like some inescapable situation that is just like too much, but you can't escape it. And so your brain just sort of shuts off the parts that, I mean, I'm oversimplifying here,
Right.
but, it's basically a way to just sort of not feel things as you're in this situation that you can't escape that is too much. So, like, if you're like a mouse and a hawk grabs you, right? Like, you can't get away. So better to just not feel anything now than, trying to fight and stuff in those moments. So it's kind of like that.
But you still have memories of it. It's not
Not
like
great.
So you also have memory loss.
Mine's after.
Okay. Not of the event itself?
No. That I was very sharp. I can remember so much of that.
But it'd be interesting.
Like, I think that got seared in.
Well, you would think that if the trauma itself is like too much, like that's when the dissociation would happen. But
no. Well, it did a little bit. Like, I did have, one of those like out of body experiences a little bit. Like, it was a kind of a split experience. Like, I was really thinking about what I needed to be doing, all the logistics that needed to be happening, all the stuff you hear on the 911 call. But another part of me was like just sort of dissociated and thinking about, like, I kept seeing, visual memories of our time together, like in college and, as we've gone through and having babies and all of that stuff. And it was just like, no, that's not how this is supposed to be. Look, here's the story. This is the story. It doesn't end like this, and that it was kind of going on outside of myself a little bit. But that was the only time, like, during the acute crisis phase that happened. For the most part, I was having to really, you dial in during the acute crisis. And that lasted 3 or 4 days, But then after you came home and it was, like, clear that you were going to be okay and we had a game plan for what to do and you started to be able to take care of yourself more than I had to take care of you. At that point, then it was like my brain felt safe enough. Like, okay, the acute part is over. So now we're going to process everything that just happened. And that was too much.
What did Preston and Margaret help you understand?
I was just curious, since I have a psychology and a cognitive neuroscience background, I remember thinking even at the time, like, this is really fascinating. Like, what's happening in here? And I wonder which, parts of my brain are involved. And because, you're just trained to think like that. So it was kind of automatic. But yeah, we talked about like the neurobiology of dissociation. We talked about how to treat it, talked about what it is.
You think they can do some meditation for you?
I don't know.
Hypnosis?
Yeah, is that what it would take? Hypnosis?
I don't know. Is hypnosis still a thing?
I don't know.
Hypnotherapy?
It's a good question.
I don't know. I know some people that do like serious like psychoanalysis.
Yeah, that's a thing again.
Yeah, I think you would probably really enjoy that. Right?
What do you think I would enjoy hypnosis?
No, psychoanalysis.
Say more about that.
So, all I know about it is you have to do like a specialized training to like after it's like a fellowship you do like the psychiatrists do. And it's like 4 or 5, I mean, you don't have the time for it, but it's like 4 or 5 days a week. It's like every day.
Oh, wow.
Like you go in and basically it's just like you just talk and they get to the bottom of all your neuroses and like all the things that are like in there. And they unlock your brain. I'm pretty sure I'm explaining it correctly.
Is that in USMLE?
That it unlocks your brain. Let's see what's. I'm sure psychoanalysis is in this thing.
It's definitely in the DSM.
What about the idea? Like, just think about that. Like going and laying on a couch, like 4 or 5 days a week for like an hour.
I'm not sure.
Does that sound
Again,
appealing
we
to
are
you?
both talking out of our expertise here.
Sure, of course, but like just as a patient,
that you have to do it that often because.
Well, it's like it's more frequent than it's not like once a week. It's like several times.
Well, I think that there's like a looser definition or like psychoanalytic approaches that are not psychoanalysis or something because. Yeah, I'm also thinking psychodynamic, and maybe that's a different thing. But there is that approach of just talking and kind of getting to the bottom of things, and it's supposed to be more durable and long-lasting than something like cognitive behavioral therapy.
Yeah, cognitive behavioral therapy teaches patients to recognize distortions in their thought process and develop constructive coping skills. This doesn't say anything about.
Psychoanalysis is, stereotypically like the thing where everything ties back to your childhood. That's the...
Anyway.
Yeah.
I just,
I hope some of that was correct.
I think psychiatry is fascinating. And I
is.
actually always tell people, like med students, if I'm chatting with med students, they're like, and whenever they tell me that they're interested in psychiatry, I always tell them that's a great field. Like, honestly, and part of that is from a business standpoint.
Yeah.
Because private practice is dying, just generally, like across medicine. And when I say that, I mean because there are fewer graduates going up, starting their own practices because of all the corporate nature of healthcare right now.
Yeah, all the private practices get bought up.
Right, existing practices are getting bought out by hospitals and private equity and stuff. So but the one area, if there's any area of medicine that I think it makes perfect sense to start your own practice, it's psychiatry, because the overhead is insanely low. Like, honestly, you need a place, and a computer, and a place to sit. Like that, for the most part. Like,
and a desk. You need a desk.
A desk, yeah. But like that's the friends I have that do this. That's like the overhead's so low, and
you probably could do 100% telehealth too, so you may not even need a place.
Yeah, and if you can do like also a lot of people do like cash pay as well. So it's you have lots of options, lots of flexibility in the world of psychiatry when it comes to private practice.
But wouldn't ophthalmology also make sense? I mean, I know you are a private practice ophthalmologist, but like you guys are so separated from the rest of medicine.
Well, from a specialty standpoint, we are.
Yeah.
But we are all medical. It's all medical based. Like billing is medical. So
but so is psychiatry.
We're using the same. Yeah, but I think we also bill differently. Like we bill based on like procedures and higher overhead things. Sometimes we need like operating rooms. We need we need equipment.
Yeah.
And so it's slightly different. I think a lot of psychiatrists will bill on time. I think that's the thing, right? And so I don't know, it's just a different like billing system. I mean, yeah, there's a lot of people still go into private practice. It's a huge part of ophthalmology, but it's just like those are the types of practices that private equity is targeting.
Yeah.
They're targeting ophthalmologists, dermatologists. I am not convinced that they would really be that interested in psychiatry offices. People let me know if that's not correct. But usually...
Why not? Because those would have high margins.
So what...
Theoretically.
What private equity wants is they want practices that have assets. And usually what that means is...
Because they want to be able to sell them?
They want to be able to sell them off. So they want surgery centers.
Mm-hmm.
They want property,
mm-hmm.
Obviously buildings. If you're just renting a building, they're not going to be as interested in that. They love buying up a practice where they own the property the practice sits on.
Doesn't that tell you everything you need to know about the private equity in healthcare model? That what they're looking for are things they can sell off.
Yeah, I mean it's. Right. Well,
in other words, they want your business so they can kill it and sell it.
Yeah. Well, sell it to themselves. Basically, what they'll load up the practice itself with all kinds of debt.
Mm-hmm.
And
yeah, the practice has to pay.
And then if the practice goes bankrupt, it's not the private equity firm that's on the hook for it. It's the practice that's on the hook for it.
Yep.
So, but oh man, we could
that could be a whole episode.
Really get into that. And we have in the past. We've talked to people talk about private equity before. All right, let's take one more break. And I guess the point is, like, choose psychiatry. It's great. It's what an amazing field. All right, let's take a break and then we'll do a medical topic.
Hey, Will.
Yeah.
What are you doing?
What do you mean?
Well, what are you wearing?
Oh, my bubble cuddle blanket from Cozy Earth.
Oh, why are you wearing that as a hoodie?
Because it's the most comfortable I've ever been in my life, and I want my bubble cuddle blanket to cover as much of my body as possible.
Well, I get that. That's how I feel about their sheets.
This is just how I live now.
I support it.
Get used to it.
They are the softest things ever.
It's amazing. So head to CozyEarth.com and use my code KNOCK for up to 20% off site-wide. Because home isn't just where you live, it's how you feel. Let's go home with Cozy Earth. All right, Kristin, choose a page.
Okay.
Choose a number between 100 to 700. Let's keep it round numbers. Nice round numbers. 100 to 700.
222.
222. What do we got? 222. We have pathology. Let me put on my or we can whip out the Tabitha.
Oh.
How about oncogenic microbes?
Okay, so is that cancer?
Microbes in cancer? Cancer-causing microbes. That's kind of cool, right? It's kind of an interesting idea. I mean, it's not cool.
No?
Like it's not a fun thing. But, But like the idea that viruses can cause cancer.
This is cool to you?
It's interesting. It's interesting.
Okay.
It's fascinating.
Okay.
Because you wouldn't think that. Like I'm sure a lot of people are like hearing that who are not in medicine, like, what? That can happen? Because you think of viruses as just something that gives you a cold. It makes you sick.
Yeah.
All right. But no, there's actually viruses that can alter your DNA and
crazy.
Are more likely to cause cancer. All right. So
do they do this is very typical of our dynamic and you're gonna hate it. But they alter your DNA in what way to cause cancer? Like how does say more about that? They alter it so where cells will replicate faster?
Yeah, there's fewer in development of tumors, it's either a certain genes get turned off or turned on that causes you to have unregulated replication of cells.
So it's more of an epigenetic mechanism?
I think it depends but probably because it's something external.
Yeah.
That's
coming in and
wreaking havoc, right? So
is the sun the same way? Like UV radiation, is it epigenetic rather than?
No, that's actually a direct effect on your cells that causes what's called thymine dimers. Yeah, so abnormal covalent bonds between your
the T's
bases. Yeah, your nucleotides. That's what I'm thinking of. I get the words eventually, folks. All right, oncogenic microbes. Do you have any guesses?
Well, I know HPV.
Correct. That's one. Do you know which cancers that is more likely to cause?
Cervical cancer. Neck or throat?
Head and neck cancer.
Yeah.
You're right. I'm impressed.
Well, I got the vaccine.
Yep.
I learned.
Head and neck cancer, cervical cancer, penile, anal cancer. And it's usually, though, two different. Here's one thing that we actually talked about.
Mm-hmm.
About well, if you have a HPV vaccine, why would you ever get warts?
Right.
Because a wart is papillomavirus.
Mm-hmm. But isn't that what HPV is? Human papillomavirus?
Exactly. So you would think that, I'm getting the vaccine.
Yeah.
So I'm not going to ever get anything caused by human papillomavirus. But there's like over 200 different types of human papillomavirus.
Yeah.
And so the vaccine only targets the two, or I don't know exactly how many variants of it, but definitely two of the ones that cause the most are the most oncogenic, the most likely to cause cancer, and that's types 16 and 18. Actually, remember that from med school. So it's HPV type 16 and 18 are the ones that cause the most cancer. So that's what
that's what's in Gardasil.
Yeah, exactly. And so all those other 198 types of HPV that might give you like a wart or something, like you might
cold sores. Isn't that also HPV?
That's herpes.
Oh, herpes.
Herpes
that's
simplex.
Right. Okay.
Yeah. You don't want that. That's
no.
not good. Different from the genital herpes.
So same situation,
herpes,
maybe?
Exactly. Different types of there's different types of herpes virus. Herpes simplex virus type 1 is typically the one that you get on your mouth or in your eye. We see a lot of herpes of the eyes.
What does that even look like? Like around the eyelids?
It's
or
actually,
eyeball?
It's beautiful.
I don't want to see it. I just would like to know, does it look the same as like a cold sore? Because that's kind of like scaly and stuff.
If it's on the eyelid, which is not how we typically see it on the eye.
It's usually on the eyeball.
Usually it's on the eyeball. It's the cornea.
Ooh.
And it's classically you have what's called a dendritic lesion. So a dendrite. You can remember what a dendrite?
It's I do.
Like branches
From the axons.
out. Yeah. So that's kind of what it looks like. It's this branching. It's almost like you can see like the virus making branches that light up whenever you put fluorescein dye on the surface of the eye. You shine a cobalt blue light and it causes it to fluoresce. So you can see the branching patterns on the cornea.
What does the patient see and experience? Because it sounds painful.
Pain.
Yeah.
It's uncomfortable.
Because it's on your cornea.
It's uncomfortable unless the virus gets so far along where they've had multiple outbreaks of this because it recurs. This is a herpes simplex virus it lays dormant in your nerves. And then it'll reactivate when you're stressed or immunosuppressed or something. And so if you have multiple reactivations, eventually it'll just kill off a lot of the nerves that supply your cornea. And so it's always a bad sign when someone comes in, they have clear corneal involvement, but they're not in any pain.
Yeah.
That's not a good sign.
Right.
Because that means that the cornea is less able to heal itself from this. I know it sounds weird, but you want someone to be in pain from this because that means that they have lots of good nerve function that can help heal. But so anyway, that's
what do they see?
Blurriness. It's usually blurry, just blurry.
So they can't see the dendritic.
No, because it's happening. It's so close to you that you can't make out something like that. It's just going to be things are just going to be blurry. Yeah, central blurry.
Okay. Well, that was a tangent.
Yeah, a little tangent. That's okay. I think people interested in stuff like that. But I could see when I would tell people they have herpes, I always specify, like, you have a type of herpes that affects the mouth and face. Because sometimes when I say herpes to people,
well, of course, the first thing you think is the STD.
Be like, I did not put my face anywhere near a genital herpes outbreak. I'm like, I get it. There's different type of herpes. You get it. It's just like a kissing disease. Like you can get it from a counter. You can get it like it's just something that you can pick up.
I feel like that's really the important part.
Yeah.
That you need to say.
In fact, probably by the time we're like 60, 70, most of us we've been exposed to herpes. We don't always get the like a viral outbreak that affects us, but most of us have it. It's that common.
Wow.
So, yeah. All right. So, back to oncogenic microbes. So you got HPV. Nicely done. Do you have any other guesses for any other viruses?
I have no idea.
So Epstein-Barr virus. That is associated with types of lymphoma specifically. So Epstein-Barr virus is your mono kind of.
Okay.
Thing.
I was like, which one is that? It's something you hear about as a kid.
Yeah, and it can cause it's associated with cancer. Don't ask me how these things cause the cancer. There's an association there. So anyway.
Okay, but question. Didn't you have mono?
Yeah, I think it's the same thing. Like all these, there's lots of different types of viruses, and it's not necessarily going to like give you cancer.
Okay,
just
but
because you have
had
mono.
Cancer, not lymphoma, but
I didn't have lymphoma. Totally different types of cancer.
Okay.
Don't try to. No. Mono did not make my testicles explode.
No, that's not necessarily what I'm saying. I'm just. Okay. I think it's something to look out for. Maybe.
Interesting. Okay. All right. Let's go on. Hepatitis B and C.
Oh.
Can you guess what kind of cancer that would cause?
Liver
cancer. Yeah, hepatocellular carcinoma. So that's a big risk factor for developing a hepatocellular carcinoma, is if you have chronic hepatitis B, hepatitis C, which is why, like, I think for hepatitis C, I know that I every now and then I see stories like people are like working. There's research being done to try to find a vaccine for that.
Mm-hmm.
Obviously, they have hepatitis B vaccine, which is we got when we were babies
for now.
And yeah. And then a booster. I got a booster of hepatitis B when I started med school.
Yeah.
We talked about HPV. H. pylori.
Why do I know that?
Helicobacter.
What is...
That is what gives you ulcers.
That's like gastric. Yeah.
Yeah. And there's the kind of a famous story of that, because everybody laughed at the guy that said that, ulcers were caused by bacteria. Mm-hmm. And so he actually drank.
Oh, yeah. I've heard
like
that
a solution
story.
with H. pylori and gave himself ulcers.
There's a lot of stories like that in science. It's crazy.
That is nuts. I think that also the same thing happened. This might be an urban legend, but I think it's true. The guy that first came up with Viagra. Mm-hmm.
Tried it himself?
Like on stage.
On stage?
Gave himself an erection. Something that couldn't happen now.
No.
But back then, when it was probably a room full of men.
Yeah.
I
guess, yeah. Just what's the difference? A stage, a locker room.
I said, he didn't do anything with it. It's just like, hey, look.
Hey.
Here it works. It works. I mean, you gotta admire it. Not the thing itself, but the idea.
Yeah.
But
the commitment to your cause.
The commitment. All right. So those are the big ones. There's other ones. There's some like schistosomes, like flukes and like parasites that can cause different things.
Parasites can cause cancer?
So there's there's like a schistosome, which is like it's like a little worm,
swimmy one,
like a little wormy thing that can cause bladder cancer. There's something called.
Does it make that noise as it swims?
There's something called a liver fluke that's associated with cholangiocarcinoma.
What's a fluke in this case? Is a parasite.
It's like a.
That's a different sound.
Yeah,
and you went down this time with your hand instead of up.
It's like a swimmy thing.
Okay, that's what the other thing was.
Right. They're both like different types of swimmy things, I think. And I should say, like, I think a couple times I've said they cause the cancer. It's an association.
Associated, yeah.
All right. So I don't.
Correlation does not equal causation.
Right. So just keep that in mind. And the last one here that I think I'll mention is the HHV8. A human. It's like a human something adenovirus or anyway, Kaposi sarcoma.
Bless you.
Kaposi sarcoma. So anyway, that's all I got. Those are your oncogenic microbes.
Okay, as we just said, it's an association, not a causation. But doesn't oncogenic mean?
Well, they're associated, but I mean, it's like, yeah, like you got to have. I mean. I think they maybe increase the risk of having those cancers. So it's not like everybody who has hepatitis C is going to get
right
hepatocellular carcinoma. But there is an association. So your risk of having that cancer goes up if you have that virus. So it's an association. There's an associated risk. But you can't maybe necessarily say, oh, you have that is going to cause you to have this cancer.
Sure, but let's go the other direction. If you do have the cancer and you had the infection, is it possible? I mean, like, does it work in the way that the microbe caused?
No, I want to say it's probably multifactorial. I think there's probably something in your genetics that predisposes you to have this, and then maybe the whatever viral infection just kind of kicked it off.
Yeah.
Yeah. But But please, as always with these topics, oncologists, don't get mad at me. All right.
Discuss in the comments.
Let's discuss in the comments. Go over to YouTube at Glaucomfleckens. Please correct anything. I am not in the habit of spreading misinformation. All right. So let's correct it, and we'll
psychiatrists too.
Yeah, whenever this episode comes out, leave us a comment, and then when we record our next episode, we will address all the mistakes that we made.
There you go.
We should have a little mistake corner, a little,
I think it's good to model how you
absolutely accept feedback.
Yeah, and admit mistakes and correct them.
Thank you, but so that's knock knock.
No, who?
So that's our episode for today. Let us know if you have any topics you want us to talk about. You can email us, knockknockhi@human-content.com. Visit us on our social media platforms. We try to post little clips of these episodes every so often and get people talking. So you can find out any of the networks out there. Also, check out our Human Content Podcast family on Instagram and TikTok at Human Content Pod. Some great pods out there. Thanks to all the great listeners leaving feedback and reviews. We love those. I want you to grow right now. Right now, if you like this episode, go leave a review over on Apple. We're trying to find the places where we don't have as many reviews as we'd like. Go leave a review on Apple. Only if it's good, though. Please.
It helps people find the podcast.
It does. We want other people to randomly learn medical knowledge in a very haphazard manner. Full video episodes are up every week on the YouTube channel at Glaucomfleckens. We also have a Patreon, lots of cool perks, bonus episodes, react to medical shows and movies, hang out with other members of the Knock Knock Hi community, early ad-free episode access, interactive Q&A, live stream events, much more. Patreon.com/Glaucomflecken. Should we do a Patreon community perk shout out?
Of course.
Shout out to the Jonathans, as usual. Patrick Lucia C, Edward K, Marion W, Mr. Grandetti, Caitlin C, Brianna L, MP Cole, Mary H, Keith G, Parker, Muhammad L, David H, Kaylee A, Gabe, Gary M, Eric B, Marlene S, Scott M, Kelsey M, Dr. Hoover, Sean M, Ryan N, Jess K, Hawkeye MD, Bubbly Salt, and Shawnee D. A virtual head nod to you all. Patreon roulette time, random shout out to someone in the emergency medicine tier. Cassandra C, thank you for being a patron. And thank you all for listening. We're your hosts, Will and Krista Flannery, also known as the Glaucomfleckens. Executive producers are Will Flannery, Krista Flannery, Aaron Corney, Rob Goldman, and Shanti Brick. Editor and engineer. That's hard to say. Editor and engineer is Jason Portizio. Our music is by Omer Benzvi. To learn about Knock Knock Hi's program disclaimer, ethics policy, submission verification, and licensing terms, and HIPAA release terms, you can go to glaucomflecken.com or reach out to us, knockknockhi@human-content.com with questions, concerns, or fun medical puns. Knock Knock Hi is a Human Content production.
Knock knock. Goodbye.
Hey, Kristen.
Yeah.
You know what I hear a lot about from other physicians?
What do you hear?
Not enough time.
Yep.
To do anything.
No.
Not enough time to see patients, to look people in the eyes, to document.
Mm-hmm.
And so that's why I'm just so thrilled by what Microsoft Dragon Copilot is doing.
What are they doing?
It's this AI clinical assistant that helps with documentation, workflow, just building the patient-physician relationship.
Yeah, because now you have time to look them in the eye and whatnot.
Yeah, it's customizable. You can automatically convert conversations into specialty-specific notes depending on what kind of medicine you're doing.
That's pretty cool.
And it saves you time, and you can actually focus on what you really need to do as a physician.
Yeah.
Which is just build that rapport with somebody, right?
That's the most important part.
Yeah, and build the trust.
Yes.
That you need.
Key these days.
Absolutely. To learn more about Microsoft Dragon Copilot, visit aka.ms/knockknockhi. Again, that's aka.ms/knockknockhi. Thanks for watching the episode. You can find more on that playlist over there. If you prefer to listen, or you just had your eyes dilated, you can binge full episodes wherever you get your podcasts. Or join the party over on Patreon, where you get early access episodes, hang out with us, get lots of exclusive bonus content. Help you subscribe, leave a comment below. Let us know what you think.